children over the age of 12 can get their COVID-19 jabs starting next Wednesday. They can register for their vaccine. Parental consent is not required. Our reporter Heidi Giokos, following that story, she joins us now. So Heidi, this really is big news. What did the Health Minister say about why they're opening up to 12 years and up from next week?
It is indeed very big news, Sally, and this is because globally you are seeing countries move into a space where they are opening up to younger age groups, and this is after the FDA approved the Pfizer vaccine for younger age groups. Government, of course, saying that the medicine regulator has done some research and has found that it's safe for those ages between 12 and 17 can get one dose of the Pfizer vaccine, and many were questioning why Pfizer and why only one dose. There were some concerns about the possible side effects that could emerge, especially in the younger age group, and government is saying that the medicine regulator says it's rather safe for those ages between 12 and 17 to get one Pfizer vaccine. There's enough protection when it comes to at least one of the jabs. What's also important here is that they can go as of next week, the 20th of October. Many questioning the fact that if you're 12 to 17 years old, you don't have an ID number, but you can register on EVDS. There will be a system on EVDS for you to register. And of course, the Health Minister is saying that this is a move to try and get as many people vaccinated as possible, given what we saw in schools with students getting ill or getting COVID-19. So they are saying that this is a move to try and get as many people vaccinated, and because of the exposure that young people have to possibly older and more vulnerable groups. Let's listen to the Health Minister on that.
This service will start on the 20th of October to allow the necessary preparation on the EVDS registration system and also other logistical preparations. We believe that this will come handy as schools start their examinations, or some of them are already advanced towards concluding their academic year and are starting to prepare for the next academic year of 2022.
Yeah, I mean, it's a sensible decision, really, because it means not only keeping that academic year on track, but also we've been doing so many reports on the mental health problems with children being isolated from their peers, children not being able to get out onto the sports field and have that social interaction, which is such an important part of a teenager's life in particular. I'm finding it fascinating that they don't need their parents' consent. And it was funny because my son sent me a message saying, oh, I believe I can get the vaccine next week.
Yes, Sally. I think it's many people were saying, even when I tweeted the breaking news that the vaccine is opening up to those aged between 12 and 17, many people were saying, not under my roof, I will not allow my children to go get the vaccine. But according to the Child Act, you do not need consent to go for this vaccine, and the Department of Health saying this is some good news, because if somebody aged between 12 and 17 wants to go for the vaccine, but they live in a house where perhaps their family members, their parents are not very keen on this, it allows them to make the decision themselves. What's also important, before we hear what the Acting Director General said, is that this vaccine will not be rolled out at schools. When we were younger, we had the vaccine brought to schools. I'll never forget that.
The TB jab in Standard 8.
Yes.
We spoke about it for a whole year beforehand. I'm terrified.
So that is not going to happen for now. The Department of Health says they're saying that it's best if you just go to a vaccination site and you will be vaccinated. There are hundreds of vaccination sites now opened up, and they will possibly look into this maybe next year or when the schooling year is over, but of course no consent required, and you can walk into a vaccination site if you're 12 to 17 years old and get the vaccine.
I mean, I understand that it's part of the Children's Act, and we're going to hear what Nicholas Crisp has to say, but you know, I'm just thinking of all sorts of ramifications, and I'm speaking to the Deputy Health Minister in the next hour. But with that lack of consent, will you know what that child's medical history is? Will you be able to properly assess, through just discussing with a child, whether they might be a risky candidate for a vaccination for a myriad of health reasons?
Yes, and I think that's a huge concern and something the Department of Health definitely needs to consider, and hopefully the Deputy Health Minister will be able to provide clarity on that, because you know, if I think back to when I was 12 years old, I mean, it wasn't that long ago. You know, are you in a position to make such a decision? And given the news around this vaccine and how many people fear this vaccine or are uncertain about it, or there's lots of sides and angles to this particular virus, are you in a position to make that decision yourself if you're 12 years old or you know, up to 17 years old? So the Department of Health saying we are in a position to allow them to do so. There's enough research. This is why we're only allowing one Pfizer vaccine, because the research we've done shows that there is sufficient protection with just the one vaccine, and we will be able to handle the situation with the one vaccine that will be administered. And it's not Johnson & Johnson, it's only Pfizer. But let's listen to the Acting Director General, Dr. Nicholas Crisp, on this particular matter.
In terms of consent for children, so the Children's Act makes provision for children from the age of 12 to 17, in other words, not yet adults, to give their own consent for medical treatment. And there are provisions within the subclauses of the Children's Act that explain which children can give consent for what. So children do not need their parents' consent generally for any medical treatment, and there are specific guidelines on that. But parents can give consent for their children to get vaccinated. So it is possible for a child to go between the age of 12 and 17 to go for vaccination at a health service without their parents' consent. That's another reason why the school health program is not being used at this stage, because there's an agreement, a multi-party agreement between health and education and school governing bodies around how consent is given and how they are vaccinated in the school health program. And as I said, that's something we will deal with in a long and ongoing process later.
Reading between the lines, I'm getting a sense that if a 12-year-old arrives without a parent, there's going to be quite a detailed discussion before they get the jab. I hope so anyway.
Yes, definitely.
But really, a really important day. And let's face it, this is happening all over the world. Children are getting the jabs, and it is safe, and it is bringing down the death rate. And, you know, we've had the world's top brains working 24/7 for months and months to make sure that this is safe, and it works, and it is safe, and it does work.
Yes,
So
Sally.
I trust the science.
Work.
I don't know about you, Heidi.
Definitely, definitely. I think the science and the data that's coming out most certainly points to that. And we do know that the Department of Health is working on getting private and public hospitals to show that unvaccinated and vaccinated, you know, the difference between the two when they are admitted to hospital. Because currently, as it stands, there are over 5,000 people that are still in hospital because of COVID-19. Wow. And the department is saying that the majority of those people are unvaccinated.
Yeah, and that's a figure to keep in mind this evening. Thank you so much for that update, Heidi Giokos there.